Hi, my name is Muriël Reudink and I'm working at the Máxima Medical Center in Veldhoven in the Netherlands. I'm going to tell you something about the metabolic syndrome and adverse outcome after colorectal surgery. Increasing evidence shows us that patients with the metabolic syndrome are at increased risk of diabetes mellitus type 2, cardiovascular disease, but also for adverse outcome after abdominal surgery. We conducted a systematic review and made analysis to investigate the impact of the metabolic syndrome on outcome after colorectal surgery. The metabolic syndrome is defined by a cluster of interrelated metabolic abnormalities that include hyperglycemia, dyslipidemia, visceral obesity, and hypertension. We only included observational studies that evaluated outcomes within 30 to 90 days after colorectal surgery. We included 6 studies. Incidence of the metabolic syndrome varied widely from 7 to 68%. That was mainly due to multiple definitions of the metabolic syndrome that were used by these studies. Meta-analysis shows that patients with the metabolic syndrome are at increased risk of severe complications, but also for any complication, anastomotic leakage and mortality, but these latter 3 they were not significant. There were only 6 studies that evaluated the impact of metabolic syndrome and outcome. So there were a few, and except for 1, they were all retrospective analysis. So they were limited by their retrospective designs. So I think future studies are needed, future prospective, adequately powered studies are needed to improve the amount and quality.